So looking at hernias and some of the different types. So a hernia is actually when you have either an organ or a part of an organ protruding through a defect in tissue. And when we're talking about the abdominal region, what we're primarily looking at is typically some portion of the small intestine and a neurovascular bundle, so basically like a bundle of nerve and blood vessels coming through with it. And if you look on the picture, you can see some common areas and the types of hernias that you have. So you could have inguinal hernias, you could have femoral hernias, you can kind of note the locations there. Umbilical hernias, and the picture even shows one, an epigastric hernia, so obviously going a little higher up into the upper portion of the abdomen. With the inguinal hernia, you could have two different types. You could have a direct versus an indirect. In an indirect inguinal hernia, the segment that herniates actually travels through the inguinal canal into the scrotum of a male. So the actual herniation will actually go into their scrotum, whereas with the direct inguinal hernia, it will more or less protrude pretty much right where you're seeing it on the picture, right above where the inguinal ligament is. And typically, when people get a hernia, sometimes acutely, they will actually be able to, will note when it happens. They could actually feel the tearing sensation. So they actually feel the tearing and the weakness in the abdominal wall, and then, usually, pretty much always when you have a hernia, the telltale sign is you actually have a lump that protrudes. So that's another thing that is very obvious with hernias. And again, depending on where the hernias occur, they all kind of have different pain patterns where the individual will note their discomfort. Hemorrhoids, which are basically dilated veins in the rectum or anus, something that could be obviously very uncomfortable for an individual. There are both internal and external hemorrhoids. So the external hemorrhoids are the hemorrhoids that do tend to protrude, and they're usually the ones that cause more of the discomfort that people experience with these. Usually what you look to deal with as far as like what causes them, some people are more genetically predisposed to having hemorrhoids. Frequent constipation, so because of the pressure buildup, it causes those veins to dilate from all the pressure buildup, and liver disease can sometimes contribute to this as well. As far as treatment, a lot of the treatment is just more or less, as you look in the textbook, there's some over-the-counter medications that you can utilize for it. But for the most part, it's just a kind of, obviously like diet and things like that can also assist as well in helping to prevent constipation. Colon cancer, so responsible for the second most cancer deaths. So you can see in the picture here, they're more or less showing you kind of what different stages of colon cancer would look like. Again, as far as like what would predispose people to this, or some things you need to be aware of, if they have if someone's over 50, if they have a family history of this, people who typically consume high-fat, high-sugar diets are a lot of times predisposed to colorectal cancer. The biggest thing, like with a lot of cancers, is early detection. So the earlier something like this is detected and can be treated, the better the prognosis is. And many times what will determine if someone's predisposed to colorectal cancer is the presence of polyps, which are basically little growths that occur in the large intestine. So if somebody does have polyps, they are kind of monitored to make sure that they're not developing into cancerous lesions. So looking at spleen and liver trauma, because these are two acute injury situations to the abdomen that could actually happen. Again, the spleen doesn't so much have functions as it relates to the gastrointestinal system, but because it's in the abdomen, we look at it here. So the functions of the spleen, we look at the spleen looks to store platelets and other blood cells, and it also helps to filter out and remove old blood cells. So that's part of the functions of the spleen. Again, the location is in the upper left quadrant. Now, when you look at spleen trauma, one of the things you have to be aware of, and if you remember going back to when we talked about mononucleosis, is when people have mono, that's the fear with mono is the enlargement of the spleen, so the splenomegaly, or the enlargement of the spleen. So anytime somebody has mono and has splenomegaly from that, that's one of the big things that needs to go back to normal before they go back to activity. So at least 3 weeks after the onset before returning to physical activity, because what happens is when the spleen's enlarged, the spleen in its normal size is protected pretty well by the ribs. When it does enlarge, it comes out from underneath the ribs and is much more predisposed to trauma. So it's very important that if someone does have an enlarged spleen, that goes back to normal before they do very vigorous activity. The liver, again, so our liver function, it has functions with digestion that we had talked about before. It also filters blood, it stores carbohydrates, and it forms bile. With liver trauma could sometimes have a little bit more of a subtle presentation, so it'll have some specific signs and symptoms as you go and put your charts together for that for the class, but it's a little bit more subtle. So the key here is that anytime somebody takes an acute blow to the abdomen, what would be some things that you would want to look for, particularly as it relates to the spleen and the liver. A lot of times you do see this happen in football when a ball carrier gets tackled and the point of the ball, this a lot of times particularly with the spleen, so if the point of the ball goes up underneath the rib cage, it could possibly cause trauma to the liver or the spleen. So that's a common mechanism that you might see in that type of athlete. So hepatitis is inflammation of the liver. And it can be caused through one of two mechanisms: either an infection, which will be caused by a viral infection, or it could also happen through liver toxicity. So probably what most people associate with hepatitis is some viral form, but people can get hepatitis from liver toxicity. And we're going to talk about a few different types of hepatitis: hepatitis A, B, C, D, and E, and just kind of talk about how they're transmitted and what we typically see with them. So hepatitis A is transmitted via an oral fecal route. So, commonly you would see this in people who, for instance, someone prepares food and they don't wash their hands, and then a person ingests the food and then they get sick from hepatitis A. Another important thing to note is which forms of hepatitis you can be vaccinated against, and hepatitis A is one of them. So there is a vaccine for hepatitis A. B, C, and D is something that you would get through direct exposure to body fluids by someone who is infected or is a carrier of one of these viruses. So direct exposure to body fluids. D is actually a complication of B. So you can't get hepatitis D unless you have B. Okay, so that's kind of an important thing to note. And you can only be vaccinated against hepatitis B. There is no vaccine for hepatitis C, at least as of right now. So again, being aware of which forms can be vaccinated against and how they get spread. Hepatitis E is another type. Actually, I don't think your textbook talks about hepatitis E, but I'll talk about it here. It's another oral fecal route. It's actually pretty rare in the United States. It would be something more to be aware of if you had athletes that maybe traveled to other countries, if you had an athlete who maybe started to show signs, symptoms of having some sort of gastrointestinal upset and some other flu-like symptoms. Looking at hepatitis E as a potential problem there. And then, as I said, we also have toxic hepatitis. So someone who's had a lot of exposure to drugs or toxins could develop hepatitis as well. And what could happen with that, we know that the liver functions as a filter Obviously, though, at the same time, too, it could be overwhelmed and damaged, particularly if some type of toxin is ingested. So the liver cells with this can become damaged and become necrotic and die. So necrotic means that, like, necrotic denotes tissue death. So if you hear that term, that's what that means. There's also chronic hepatitis. Many times people who get infected with hepatitis C can develop a chronic infection with that as well. So that's something else that goes along with the pathology of hepatitis. So with hepatitis, you typically have 3 stages. You have an initial stage, an icteric stage, and a recovery stage. So in the initial stage, the individual may not have symptoms right away. However, they are contagious. So if they are infected, they can still pass the infection on to others, based upon obviously the route of transmission that the type of hepatitis would be passed. During the icteric phase is typically where one of the hallmark things of that is the person will usually become jaundiced during that phase. So as you remember, we talked about at the beginning of this discussion in class, we talked about what jaundice is. When there's excessive amounts of bilirubin in the blood, the person gets that yellowing of their skin and their eyes. So it's usually around 6 to 8 weeks, and then the recovery can be 4 months or longer, and many times the person will experience a lot of fatigue during that time as their body is attempting to recover from this. So from a prevention standpoint, what I want you to think about and look at kind of on your own a little bit. So we obviously know the routes of transmission, so obviously think about what would be some ways to prevent infection with hepatitis based upon the way that it gets transmitted. So cirrhosis is a condition of the liver, and it can result from either just chronic liver disease and or malnutrition. What essentially ends up happening is the cells of the liver, which are very specialized cells. If you remember going back to the beginning of the semester when we talked about cellular pathology, the liver is one of the areas of the body, like many others, that actually have specialized cells that produce its functions. You get cell damage, tissue death, fibrosis, so basically you get scarring, basically replacing the functional tissue and the functional cells of the liver. So that's going to interfere with the vascular supply, which again will cause further tissue death and obviously impact how well the liver is actually able to work. So this is not a curable disease, and it does not heal. And usually what we most commonly associate with this is alcohol abuse. So people who abuse alcohol and consume large amounts of alcohol, the liver is one of the primary areas obviously in the body for kind of filtering and metabolizing alcohol. So if it kind of gets overwhelmed and overused with that, it predisposes the person to developing cirrhosis of the liver. Gallstones and gallbladder disease, or cholelithiasis and cholecystitis. So cholelithiasis is the actual formation of gallstones. If you look in the picture on the slide, you can actually see an actual gallbladder. So remember where the gallbladder is. In the upper right quadrant sits in and around back with the liver. And remember the function. The function of the gallbladder is to store bile. And you can see actually in the gallbladder they almost look like little marbles, and this is a gallbladder that is full of gallstones. And gallstones will basically form due to various factors, and more particularly the increased risk factors for this are age, obesity, high cholesterol, diabetes, and actually females are more prone to gallbladder issues because of the increased estrogen levels. So these little stones end up forming in the gallbladder. If they happen to block the cystic duct, you could end up with cholecystitis or gallbladder disease, so where the gallbladder actually gets inflamed. And usually the way they correct this is through laparoscopic surgery. They do a scope and they go and remove the blockage. Pancreatitis is inflammation of the pancreas, and this is when you get this when the pancreatic enzymes become active in the pancreas. So again, anatomically, you can look and see where the pancreas is. We're looking at the upper left quadrant, so it's kind of reflected in the picture. It actually sits behind the stomach, so it's posterior to the stomach, inferior to the liver. And if it progresses, if it's infection, it could progress into septicemia, where the bacteria goes into the bloodstream. So, and that becomes a very serious condition that requires, pretty significant medical attention. Kind of the one hallmark thing. It's not the only sign symptom, but this is a very painful condition. So, if you get somebody who has a significant epigastric pain, this could be something that you would be thinking about with that individual. So these are your learning outcomes, and again, as I said in class, I think something that becomes really important with the abdomen is just, again, being aware of those abdominal quadrants, where those different organs are in relation to the quadrants, because that could again give you some ideas as far as what's going on with the individual based upon your exam and where you palpate and where they have pain. So really important to kind of know that, and obviously the functions of the organs and what they do, because that can also give you some insight into some conditions. And for the most part, most of the abdominal things that you're going to see are going to be pretty benign. Either just general, just gastrointestinal upset because of when somebody ate something or what they ate, or even just trauma. But typically, again, a lot of times the trauma just ends up being musculoskeletal. The muscular tissue gets bruised, or or the ribs do. But again, understand those signs that could kind of tip you off. And there are even some things I know we had talked about in class, as it relates to, what are some other tests or some other ways you could kind of differentiate, particularly as it relates to abdominal trauma.